Hi friends, I am Dr. Vinayak Mahajan, a gynecologist, obstetrician and hysteroscopic surgeon and a medical director of Ashwini Hospital and Endoscopy Center, Chinswad, Pune. Friends, today we are going to discuss how a hysteroscopic endometrial ablation is performed. So before that, we should know what is endometrial ablation. Destruction of endometrium by any method of energy transfer is called as ablation. So, ablation is defined as destruction of the function and or removal of tissue. Resection is defined as removal of tissue.
When the endometrial ablation is done with a resectoscope, it is called as hysteroscopic endometrial ablation. Now the equipment used for the hysteroscopic endometrial ablation are: first, a Indian made hystropump; secondly, Arbe Bio 3 electrosurgical unit; third, 18.5 French Arbe bipolar resectoscope. Now primarily the electrode I use is a loop electrode and a ball electrode. The distension media which we use is 3-liter normal saline pouch. Before starting any hysteroscopic surgery, a checklist has to be conducted. First is check the appropriate distension media, pressure settings on the hystropump. I usually start with 70 mm of mercury on the hystropump. The electrosurgical unit settings for YO3 I keep it at 3/5. Remove air bubbles from the tubing. Wide balancing and focusing. The step 1 is the anatomical survey of the uterine cavity. Now remember, the first instrument to enter the uterine cavity should be nothing less but a hysteroscope only. The diagnostic hysteroscopy is done with 2.9 mm 30-degree hysteroscope with 5 mm continuous flow operative channel Betaki sheath. For resectoscopy, the ideal telescope is a 12-degree. Once a diagnostic hysteroscopy is over, you can proceed with the dilatation of cervix if you are using a bigger resectoscope, that is a 26 French resectoscope. Whenever I am planning for a resectoscopic surgery, I prefer giving tab misoprostol 200 microgram per orally with a sip of water 2 hours prior to the surgery.